In an emergency situation, providing rescue breaths quickly, securely, and without leaks is truly mission critical. You won't have a second chance. The NuMask CPR IntraOral mask is equipped with the one-way valve and filter for superior provider and victim protection.
The NuMask has a notch designed for the patient's frenulum, and the NuMask logo should point up toward the patient's nose. To insert the NuMask, lift the lateral edge of the lip and insert one flap horizontally. Subsequently, grasp and lift the opposite lip edge and insert the remaining flap under the cheek. Manipulate the stem of the mask if any portion of the lip is not seated properly. Standard NuMask CPR Grip. The standard CPR grip is performed by cradling the chin in the palm of the hand. Closing the hand will pull the patient's cheeks and lips around the stem of the mask. The nostrils are pinched closed with the opposite hand and the head is tilted back. Rescue breaths can now be administered. Child and infant grip. For children and infants in whom the IOM does not fit into their mouths, the mask is applied to the outside of the lips. The IOM is then sealed by applying downward pressure on the flanges of the mask. The nose is sealed by pinching it closed with the other hand. Here are a few teaching points. Leaks. If a leak is apparent, release your grip and reapply by grabbing more of the patient's facial tissue. Then close your hand, pulling more of the patient's lips and cheeks toward the stem of the mask. Hand slippage. If hand slippage occurs, reapply the grip with more downward pressure. The fifth finger should be placed under the patient's jaw to anchor the grip. CPR compression and rescue breaths. With the NuMask placed in the victim's mouth and the rescuer situated at the side of the victim, transitioning from compressions to rescue breaths can occur in seconds. Compared to prior masks, this decrease in transition time enables a single provider to deliver CPR just as effectively as two rescuers performing CPR with other face masks. Let's take a look at some more advanced techniques. Modified CE Grip. The modified CE grip is performed by wrapping the index finger around the lower lip and placing the patient's nose in the first web space. The remaining fingers are hooked under the jawline and the hand is closed, pulling the lips around the mask and occluding the nose. Rescue breaths can now be administered.
Thanks for taking a look at how our intraoral CPR mask is administered. I'm sure you'll agree, quick and effective ventilation is of life and death importance in an emergency situation. We hope our system will give you those crucial extra seconds that can really make a difference.